1, 2, 3, hello. We are back with Ortho Barista, where you can learn orthodontics easily over a cup of coffee. This time is a special live Q&A session. Ask whatever you want to know about clear aligners. It's been a long time.
Is it in 4 months? It is an honor to see you again.
It's really been a long time. Actually, it is the first time this year we are talking to you.
Yes, it is.
I have a special question for you. Guess what?
Is this a quiz?
Can you guess what these numbers mean? Number 4, 5, and 6?
Well, does it have to do with Ortho Barista?
Yes.
Does it?
Yes, it does. Sorry for that. It is because we are on a live broadcast today. This is the very reason why we are doing this special session today. These numbers mean that we have so far received a whopping of 456 questions from viewers. And most of them were about clear aligners. 169 questions about clear aligners.
It is really impressive. As we go through many sessions, we have actually received lots of questions, but it was not possible to answer all of them due to time constraints.
That is so true. When we are trying to answer questions, another wave of questions swarmed the chat room. That's why we thought it would be better to answer all the questions about clear aligners through a live broadcast.
Today's session will be divided into 2 parts. In the first part, we will select the top 5 among the questions we've received during Ortho Barista sessions. And into the second part, we will be open to any questions you have about clear aligners to give you quick answers right away.
We will spend more time in the second part and give you more gifts. Don't miss it, or you will regret it. Right now you can go to the Dental website and leave questions about clear aligners on the live chat room. We will give you answers in real time, and through a lucky draw, we will give you Starbucks coffee coupons. And at the end of the show, we will select the best question and give a cute Vueson Music Tiger dental set. We look forward to your participation. Now, let's get started. Before we officially begin, we have coffee for us. That's what Ortho Barista is for.
Exactly.
This is iced coffee from coffee brand S.
Ah, is it?
Please have some. First, for today, we have selected the 5 most frequently asked questions. First, side effects of the orthodontic forces. Next, how to use screws. And cases regarding an open bite and deep bite. Then IPR and how to clean orthodontic appliances. We will answer these top 5 questions one by one. First question is about side effects. Most of the questions were about the forces applied through orthodontic appliances. What would they be?
Usually, it is a textbook knowledge that teeth should be moved by changing forces every 3 weeks. As for clear aligners, we would move teeth by applying different forces every 1 to 2 weeks. Given that, isn't the cycle too short to ensure recovery, or aren't there any side effects, such as root resorption? Most of the questions were like that.
In fact, this is one of the top questions we get when we deliver clear aligner lectures. Usually, when we say light force, teeth movement will begin from the 2nd or 3rd day, and in the case of heavy force, teeth movement will start from the 7th to 14th day. To give you a conclusion first, there are many factors to consider, such as the types of teeth movement, how to pull the teeth, and about occlusal force, and so on. The bottom line is that orthodontic force applied through clear aligners is more predictable than through brackets, and our usual assumption is that 0.2 millimeters of movement is made per aligner. So, the predictability is higher in clear aligners. Thus, in a word, you don't need to worry much about side effects such as root resorption. What's your thought about this?
There are actually many researches and papers about the question which case suffers more root resorption, brackets, or clear aligners. The truth is that there is no big difference. There is no confirming evidence yet that suggests clear aligners will see more side effects. So, like you mentioned, given that there is more predictability and we can move teeth as much as want or in terms of the target tooth movement, I think clear aligners have some benefits than general bracket-based treatment. It also comes with less reaction and less jiggling effect.
In bracket treatment, haven't you had the temptation to apply more force to induce more movements and more quickly when we retract the anterior teeth or use nickel titanium wires? Like using stronger power chains or more ligation?
I think it is not just me. Many of you must have thought of doing that. But what really surprised me when I first tried minor orthodontic treatment was that space can be easily created for teeth movement even with 008 nickel titanium wires. It was very easy to have the teeth straightened. That made me think we have been applying too much force than necessary. I think that many other clinicians would agree with me.
And for your information, there was an episode about molar uprighting. In the episode, we had an interview with Professor Kim Min-ji. You can check there that posterior teeth are moved with a very light force due to a simple mechanic, even with the occlusal force. When you think about it, as I mentioned earlier, the orthodontic force delivered by clear aligners about 0.2 millimeters to 0.3 millimeters per segment is, in my opinion, closer to light force. So, I think that there are no issues with the force can be an answer to the first question. Next to the topic of using screws. In clear aligner treatment, do you use screws a lot, and in which case do you use them? Well, how about you? Do you often use screws?
In clear aligner treatments, I don't use screws that often, but the main reason for using screws is when we need mechanics for an open bite case or molar distalization.
Yes, that's correct. So for one, screws are needed in terms of mechanics, and for another, there are cases where people find it hard to place elastics on their own. Then, we can use screws as an additional tool for them. Let's take a quick look. Usually, we use screws and elastics as well for anchorage and anterior-posterior corrections. For example, when moving molars posteriorly, we use screws to pull number 7, number 6, number 5, number 4, and number 3 en masse.
Things will be a bit different from general orthodontic treatment.
That's right. When pulling the teeth, we need to note that if the number 7 and number 6 are moved backward, then the anterior teeth will inevitably move forward. This is an inevitable side effect. If you look at comparison between two photos, on the second photo with screws, you can see that number 3 and number 4 have moved forward.
Right, when we compare here and here. There is no change here, but you can see the distance on the second photo.
Right, and between number 7 and number 6 and number 5, there is some space. Molar distalization is underway. I was a bit late and started using screws when I was moving number 6 backward. Anyway, as you can see, the reaction happened in that short amount of time.
So, you're saying that before applying screws, while number 7 was being distalized, reaction immediately happened.
Well, when it comes to distalization for crowding, it shouldn't be a big issue. You can use tools, whether it be screws or elastics, when you are on number 6 or number 5. But in the case of AP correction, like using Class 2 or Class 3 elastics, if you use screws, I personally recommend you to get ready to deal with reaction early on, when you're starting on number 7.
This is a very good tip.
Yes, that would be great. So, in conclusion, it seems that screws are used more often than expected. Here, you can see that the Class 3 elastics are being used, and screws are being used for various reasons.
So, there are two forces at play here.
With clear aligners, sometimes elastics need to be worn for a longer period, but patients have difficulty wearing them properly.
Yes.
They often can't wear them properly, or can't wear them for long enough. How about you?
When they wear the aligner, they can check for that.
But if it is for more than 2 teeth, then it will be difficult for them. So, sometimes, for prevention.
You use power chains.
Yes, sometimes I do.
If patients don't wear aligners properly, they would be in a trouble, right?
Right, not putting in aligners properly.
With additional tools on them, then, it will be a problem. It may lead to teeth rotation, so it needs caution.
While you are following our lectures, there are things for which you need to read between lines. That means there are many considerations you need to make. Anyway, let's now move on to the third question. It is about clinical cases using clear aligners, especially about open bite and deep bite cases. In general, clear aligners are said to be more favorable for treating an open bite, while deep bite is considered a bit more difficult to treat. So, let's start with a brief explanation of open bite treatment.
Actually, for an open bite, the treatment varies greatly depending on the strategy. Generally, we either lift molars up on the maxilla or extrude the anterior teeth downwards, or we can use both of these methods together. The key is to determine which approach to take. Another consideration is retention. Since relapse happens quite easily, we need to plan for that, but for an open bite case, which is the easiest to treat with clear aligners, slight extrusion and distalization of anterior teeth can be a good approach to start with. When there is an open bite in the molars, there are limits to what we can do with aligners alone. So, in some cases, we add buttons and use elastics to help close the open bite. This way, the open bite can be gradually resolved.
And as for indications, actually they are more of side effects. After wearing clear aligners for too long, or biting too much with chewies, then the posterior teeth can open. Those patients can come to us and ask questions. In those cases, we can use this approach to address that open bite cases caused by side effects, which can be turned into benefits in clear aligners. So you can think of this approach in that sense. And in terms of mechanics, how should I say? Maybe bite block effect? In that sense, I would like to say that clear aligners can have their benefits in an open bite case. Of course, there are other factors to consider, such as attachment, but still clear aligners are definitely useful to deal with an open bite.
It won't be easy, though. In fact, I find deep bite more challenging than open bite.
There are anatomical and other factors to consider. When I have time later, I will explain more of it. Previously, when we were explaining cases, we discussed various principles regarding deep bite. This is the same in bracket orthodontics. For instance, we can flare the lower anterior teeth, intrude them purely, erupt premolars, or induce eruption of premolars. In this way, we can induce both relative and absolute intrusion. We'll look at a case now. You can see that we induced intrusion through the 3 ways of teeth movement that we explained earlier. Here, you can see a bite ramp. As you saw earlier, it was actually mentioned in the bracket orthodontics.
This is a bite ramp, isn't this?
Usually, it will be placed from number 2 on one side to number 2 on another side. And depending on cases, it can be changed from number 3 on one side to number 3 on another side in the ordering. It looks fine, doesn't it?
Yes, it does. It improved a lot. Crowding has been dealt with.
Well, it's only been a year and a month. So 13 months have passed. It's almost done now. The main issue with bracket orthodontics in deep bite cases is that without using special devices, it's not easy to place some appliances on the mandibular anterior teeth.
No, unless you approach from the lingual side.
Right. That is why we use devices like ABP, or the treatment time can be extended inevitably with delays. So, by using those devices and structures, even though it's not easy, deep bite can still be resolved.
Right.
This is something I've explained before.
You can search for video clips. They can be helpful.
This case has some AP correction issues. It's been 14 months for this case.
If you look here, this calls for uprighting, as teeth are slanted inward.
Right.
If it were in the past, I would not have believed that clear aligners can solve this problem with root movement. But as you can plainly see in the results, this did actually work. Of course, it requires lots of efforts and cooperation from the patient. But I think that this movement is feasible by clear aligners.
Right. Of course, like you said, there are some anatomical things to consider, like the width of housing that covers the tooth and etc. Anyway, is it feasible or not?
It is feasible.
Yes, it is, as you can see in the results. I hope you can select appropriate cases for clear aligners. Next to the fourth question, it is about IPR. While orthodontists feel familiar with IPR or dental stripping, general practitioners and prosthodontists sometimes find the tooth preparation or IPR difficult. Actually, there are many journals or papers about the thickness of enamel layer of a tooth. So, based on them, we usually say that about 0.5 millimeters on a side will be appropriate for anterior teeth and 1 millimeter for premolars. Can you share some tips?
Yes, actually I mentioned this once before in our sessions. There can be many ways for IPR, and each clinician would also has his or her own technique. Lots of people are saying that a diamond burr is not recommended. This is because, in the past, a proximal diamond burr itself was very thick. So, there were unnecessary reductions in IPR. But nowadays, diamond burrs have become very thin.
Thinner than in this image.
It is almost like a needle.
Right.
So there is a diamond burr as thin as a needle. And there are sets like this. I wouldn't recommend this disc type, though, as it is a bit hard for me to handle. By approaching from the lingual side with a very thin burr, you will first open the contact. Usually, I break open the contact by about 0.1 millimeters.
Breaking open? That's a good expression.
Yes, by opening the contact, about 0.1 millimeters of space will be secured. And then, you will go ahead with dental stripping with tools like this. If you just go to these tools straight away, it can be too tight to enter. So, I use a very thin diamond burr to slightly open the contact. There are various methods depending on the thickness of a stripping tool. But I usually start with a diamond burr to slightly open the contact and start from 0.2 millimeters and expand up to 0.4 millimeters. That's how I perform IPR. For more detailed videos, you can refer to our previous broadcasts. That should be helpful. If you're still nervous or if you think you lack experience with this, you can use hand strips like these. If you look here closely, you can see that a long strip was divided into 3 parts. When I first started practicing, the clinic was very small, so I had to do everything manually. But doing it manually really isn't easy. It is not comfortable for patients, too. Of all those tools I shared, you can pick as you want.
And here is my tip. When the space is not enough, or it is not comfortable to use other tools, I use this method. That is a separation ring. It can be too thick for anterior teeth, so it hurts. That's why I am using O-ring, you know, the ligation O-ring. The clear one. I place it on the anterior teeth for about 2 to 3 days. Then, as it will ensure PDL space, it will be helpful to you.
Some fluoridation can also help. Next is the last question.
It is not the question asked during broadcast. But at offline seminars and workshops, we get this a lot. People often ask about cleaning orthodontic appliances as well as clear aligners. They can stain over time, but once aligners are replaced frequently, it's not a huge issue. However, people still ask about it a lot. How about you, Dr. Lee? How do you clean them?
Honestly, I've never been formally taught about this. It's not like textbooks say about this. These days, since clear aligners are so widely used, I get asked about this often, and I've discussed it with other clinicians. I personally recommend using a specialized cleaner. There are many opinions on whether you should use toothpaste or not, as there are concerns that abrasives may cause scratches. I've heard that some patients complain that toothpaste gets stuck in the holes of the attachments. Since foam toothpaste has soft properties, I recommend using a very soft toothbrush with it to clean the aligners. In the past, I used to tell patients to just clean them with running water, but it seems that doesn't remove all odors and isn't a perfect cleaning method. So, that is how I tell patients. How about you?
Same, here. Actually, when it comes to clear aligners, as you mentioned, you can be more careful by cleaning them with denture cleaners. But, honestly, the retainer seems to be more of an issue, right? When people wear their retainers for a long time and wear them really well, plaque or something like that can build up. In that case, we can use ultrasonic cleaning or use something like a round burr to gently remove and polish it off for them. When cleaning clear aligners, personally, I also use these types of cleaners.
Yes, they are specialized cleaners.
Right, this can be a tip. Alright, today we've answered the top 5 most frequently asked questions. We did our best. How did you find it? I hope you were satisfied with the answers. Even now, during this session, we've gotten a lot of questions. Well, we will be back soon with the part 2. That brings us to the end of part 1, the session for the top 5 questions. We'll see you in part 2 shortly. Part 2 will be a live Q&A session, so please keep watching. A bit shy to say this out loud. Stay
tuned.